Hello, this is Dr. John Bray Morris, and you are watching the ongoing series Shooting Up in the Dark, where we discuss all matters related to addiction, opioid use, and chronic pain. And today I'd like to address an important topic which is unfortunately in the midst of the COVID pandemic become more, has come to the forefront of my attention, and that topic is relapse. Relapse is when a person in recovery from addiction who has a sustained period of sobriety or clean time reverts back to using their substance or any substance or back to a behavior that they were previously addicted to. Relapse is not an unusual phenomenon. In fact, many addicts who have sustained recovery will relate in their story that they had one or more relapses prior to being able to attain sustained recovery. And one of the messages I want to get across is in that sense, relapse is often a part of recovery, and it should not be viewed as an ultimate failure. Anyone who relapses can get back into recovery and is welcomed back into recovery. There are a number of reasons why relapse may happen, or why it can be difficult to sustain continual recovery. One of them is that I've seen in some of my peers and people locally in my recovery community. One of the challenges I've seen is because of this COVID pandemic, there is a lack of access to direct meetings, direct contact with groups of addicts who are in recovery. And these meetings and this fellowship is a key part of sustaining being clean for me, and I know for a lot of other people. And I found it challenging, despite the fact that there are meetings on Zoom in many communities, and there are national and international meetings on Zoom, which I will reference at the end of this video for anyone who wants to access them. But not having, the sense of isolation, the sense of not being connected as much to others, people needing to quarantine and stay by themselves, this can, instill in a lot of people a sense of real aloneness and sadness and despair in some cases, which I think has contributed to the increase in relapse rates that are being seen, at least that are being seen in my area lately, since we've had to be dealing with this pandemic. It's crucial to remember that addiction is a chronic disease, so those of us who have addiction have a disease for the rest of our lives, which we can manage and which we can recover from, but we're never completely free from that tendency towards our addiction. And that's why we need chronic maintenance of our addiction, just like any other chronic illness like diabetes or chronic lung disease needs daily treatment and daily maintenance. And when that is not met, relapse becomes more and more of a risk. I know for me, relapse is part of my story. I had 4 years clean, and a combination of catastrophic circumstances all occurred simultaneously in my life. And despite the fact that I did have support in my life during that time, I became completely overwhelmed, and I lost faith in my recovery community, and I lost faith in my higher power and my ability to handle everything that was happening to me. And I reverted to what was known and what was comfortable to me in the past, which was using drugs. And thankfully that period of time was finite, and I did get back into recovery. In my experience, when I did relapse, my recovery community was aware of it. I was honest about it happening, and they were more than happy to welcome me back and to help me get clean again and help me back into a sustained recovery. And now I'm in my 4th year of recovery continuously and continual clean time again. And I've learned an awful lot from that experience of my own relapse. Having a relapse does not mean complete failure. It does not mean that recovery that we've gained and what we've learned about ourselves and about our addiction and about how to live and cope with it has been completely lost. People can have a period of recovery, relapse, and then come back and continue working on their recovery, addressing why the relapse happened and why that belief that we could successfully use our drug or our alcohol or our behavior, why we could believe that would be a positive, or why we could do it successfully. That needs to be addressed, and is always a big lesson of relapse. But it doesn't mean that we lose what we've gained in the past if we've had sustained work in recovery, whether that be work on ourselves, working 12 steps, or any other personal and spiritual transformation we previously experienced is not lost. And that's an important point to remember. Of course, relapse has to be taken extremely seriously just because of the fact that relapse is an event that a lot of addicts don't survive. And relapse is a situation of extremely high risk for overdose and for accidents and for tragedies to happen. And so a lot of what happens in recovery is oriented towards the prevention of relapse. And in terms of preventing relapse, that's why working a program, a daily consistent recovery program, is so critical, whatever that program may be. For me, it's a 12-step program, but it can be different for others. But having a program is critical. When relapse does occur, however, it's incumbent upon the recovery community, all of us in it, to, with open arms, welcome back and encourage back the individual who has relapsed, recognizing that none of us are immune from the possibility of this happening. And if you talk to addicts, there are only a minority who have never experienced this. So I know for myself that if an addict has relapsed, I can relate to that, and I have compassion for that, and want to welcome them back and help them get the help that they need, whether they need detox first again, or they need to be hospitalized, or whatever they need to be welcomed back into the recovery community. And that is critical, that we all have that attitude of welcome, forgiveness, and non-judgment, and enjoy, really, when a person who is, whether they are coming into recovery for the first time or they're coming back into recovery, just joy to welcome them back as a miracle, as another example of a miracle. It is a miracle when anyone stops their addiction, because addiction is an incredibly powerful and destructive disease, and many people never find their way out of. So anytime, regardless of background, when someone comes into recovery, it's a miracle to be celebrated and that we need to try and facilitate. If you are a person who happens to have relapsed, I implore you to come back. And I want to just emphasize that you're not alone. There's so many of us, so many of your fellow addicts in recovery who have also relapsed, and they understand and know how difficult it is to get back out of that. But I implore you to seek the help and to muster the trust that you are welcome back, and that you're loved, and that you can regain your recovery and go on and have a different kind of life. No one in active addiction for very long enjoys their life. There's the sense of being trapped, being humiliated, and just that life is not worth living is so common in active addiction. And so, but people who relapse sometimes feel like that's their fate. But it's no one's fate. There is no addiction that's hopeless. There's no person who's hopeless in addiction. You are welcome back to your recovery community, and I encourage you to reach out for the help that you need to get back. Almost paradoxically, relapse can have an upside as well. When we return to recovery after relapse, and this was the case for me, I had a much deeper understanding of what my addiction was, who I was in the context of that, and who I was not, and really what I needed to do and what I wanted in my life to stay clean, to stay growing in recovery, and to bring this message of recovery to other people. So relapse can be a part of recovery, but getting back into recovery is so key and so critical. On this next page, I'm going to list a couple of online links where you can gain access to online meetings, both Narcotics Anonymous and Alcoholics Anonymous meetings. And I encourage you to use those, and also to reach out to your local groups who will have their own online meetings, and call a recovering addict or someone you've known from recovery today. You're welcome back into recovery, and you're loved and you're valued.